Mm, that's water, in case you're wondering. It's not wine. Okay, good afternoon. I'm glad you joined me again. It's Saturday, October 11th. My company has come and gone, and now we're going to talk about a subject that most people know a little bit about. Most people don't realize how much there is to know about this subject, and I think most people will agree with me that it's an epidemic, and I'm talking about type 2 diabetes. And actually, type 2 diabetes and obesity are epidemics, but for now and for the next couple weeks, we'll focus on type 2 diabetes. And I'm sure all of you, unfortunately, all of you know someone who has type 2 diabetes. It could be you that has it, or someone that in your family or friends. I have friends and family that have type 2 diabetes, and some have had it for a couple of years, some have had it for many years, some have just been diagnosed with fatty liver disease, which is just a matter of time before they're diagnosed with type 2 diabetes, unfortunately, because they don't have the right information. So I'm going to enlighten you about some things, and you know, it's not going to be easy, because when people get set in their ways, and when people look at doctors or allopaths as gods, it's really difficult to go against those kind of people that go to medical school and you know, learn so many things about sickness and disease and all that kind of stuff. But I'm going to be telling you a lot of cool things that you didn't know about. So let's get started. But before we get started, I'd like to share that one verse with you again. It's in 3 John 1:2, and that's in the New Testament, and it's towards the end, right before the last book of the New Testament, Revelation. So in 3 John we read, "Beloved," which is you and I pray that you may prosper in all things and be in health, just as your soul prospers. So I strongly believe that God wants us healthy. And a lot of people are unhealthy because they just don't know that they don't know, you know, ignorance. And so let's start with, I Googled something earlier today, and which are all lies. But so when you Google things, don't think they're all true. You know, just investigate a little bit, and just remember that there's truths and lies on Google. And so we're going to start with, I found something that said, can type 2 diabetes be cured permanently? Okay, so it says, even though there is no diabetes cure, diabetes can be treated and controlled, and some people may go into remission. To manage diabetes effectively, you need to do the following. Manage your blood sugar levels. That was from September 9th, 2020. And that is one big fat lie. And eventually I'll tell you why. Another question. When did type 2 diabetes become an epidemic? The answer. In 1994, the head of the Centers for Disease Control and Prevention's CDC diabetes program declared that diabetes had reached epidemic proportions and should be considered as a major public health problem. That's partially true, and I'll tell you why eventually. This is my favorite one. Is type 2 diabetes genetic? I know most of you probably have heard that, because I know I have. Like type 1 diabetes, type 2 diabetes is inherited. Big fat lie. This means a group of genes that can lead to type 2 is passed down from mothers and fathers to their children. Not everyone who inherits the genes will develop it, but if you have the genes for type 2 diabetes, you've got a greater chance of developing type 2 diabetes. So what I would like people to ask, because I would love to ask I don't have a family doctor, but or a nurse practitioner. I usually go to a nurse practitioner because praise God, I don't have any chronic disease. I don't take any medication. And at 57 years young, I don't have the need to go to a doctor. When I have gone to a nurse practitioner, I just go for blood work. I like to know how my blood work is and how it changes throughout the years and that. But I would love to ask the doctor, what's the name of that gene? The type 2 diabetic gene. It doesn't exist. So, if you have a good doctor, he'll tell you there's no such thing as a gene for type 2 diabetes. But anyhow, so I found those things I Googled, and I found them pretty interesting, because when people look up this information, most of it is not true. So that means that you have to dig a little deeper. I dig deep, because there are so many things that in the last 10 years about type 2 diabetes that have come up, new research, new studies, and there's a small percentage of doctors that take the time to read that new research, and they become enlightened. They get a light bulb moment, and they decide, oh wow, I've been lying to my patients all these years. And I think the most difficult thing for doctors to do, because a lot of them, they wear their education and their degrees and all that on their sleeves, so a lot of them, they find it very difficult to say they're wrong. Yeah, so we'll talk about that in detail later on, but just remember that there's new research all the time. In the last 10 years, there's been amazing research, and we'll cover some of that each week, starting next week, and how I'm going to tell you something really, really important, and that is, you need to remember, as of today, you need to remember, type 2 diabetes is preventable and reversible, and I'm going to show you how and why. But today we're going to talk about the roots of type 2 diabetes and where it came from, and because most of the time you're going to understand things when you understand where they came from, how they came to be, and the more you understand, the more you understand type 2 diabetes and where it came from, the more you'll get it, because it's not just the people in the medical field that understand this chronic disease, but it's people like you and I that don't go to medical school that can know all these things that are out there now with this all this information that we have online, that we have access to. You don't have to be a doctor to learn about these things, and this is your body. This is the only body you're ever going to have on this earth, and so we got to take care of it because we live in it, and nobody wants to age in a sickly manner. I mean, I know I'm getting older, and I will be an old lady someday soon, but not soon, but in the next 40 years or so. But I'm going to be a healthy old lady. I'm not going to be a sickly old lady. And so many people just think that type 2 diabetes is something that you get as you age, or something that you inherit, and that is not true. So let's talk about some of these things that came about. Type 2 diabetes has been around for a long time, and it comes from the full name is diabetes mellitus, and diabetes mellitus came from the Greek word meaning siphon, to pass through, and the Latin word mellitus means honeyed or sweet. And this is because in diabetes, excess sugar is found in the blood as well as in the urine. And so diabetes was first discovered way back in 1552 BC in the 3rd dynasty. Egyptian papyrus physicians discovered in their urination, and then later on we go into, we'll skip down to some other things. In a British scientist in 1936 discovered the differences between type 1 and type 2. But before that, in the 1800s, someone tasted urine of someone that had type 2 diabetes, and it was sweet. And so in 1675, the word mellitus means honey was added to the name diabetes. So with the bottom line is diabetes, type 2 diabetes has been around for a long time. And so then we skip down to 1797, where a Scottish military surgeon, John Rollo, R-O-L-L-O, he suggested an all-meat diet to diabetics, type 2 diabetics, and he was very successful in that. Then we skip down to 1921, where insulin is discovered by Frederick Banting, Charles Best, and John MacLeod at the University of Toronto. Okay, so what they did was they isolated insulin from the pancreas of cows, because that's where insulin is made in the pancreas, released from the pancreas. So they got that from the cows, they purified it, and they administered it to the first 14-year-old patient that had type 1 diabetes, and he only weighed 65 pounds. And so after he started the insulin injections, his symptoms and signs rapidly disappeared, and he immediately gained weight, his normal weight. So he went from, so they did that for 6 other patients with a lot of success. So the average lifespan back then, in the early 1900s, it was a 10-year-old lifespan, and it went up to 35 years after the insulin came into play. So that's amazing. Eventually, Eli Lilly and company partnered with the University of Toronto, and they commercially developed this new drug, insulin. And so by 1923, 25,000 patients were treated with by injecting insulin. So fast forward to 1959, where they discovered that there's 2 different types of diabetes, type 1 and type 2. And the type 1 is you need insulin, and type 2, you don't need insulin. But by 2003, they stopped using these terms of insulin and non-insulin dependent. So, excuse me. So a lot of things have happened from that time, where in the 1800s or BC, where I was telling you, BC 1552 BC, all the way to now. So now we go to the 1950s, where a lot of Americans are getting heart attacks regularly. And so then they think, well, it's a dietary fat, and there's another story to that, which I'll get to that later, and believed to increase blood cholesterol, and then leads to heart disease. So guess what the doctors said? Physicians advocated lower fat diets, and they actually demonized dietary fat. And so in 1968, the government formed a committee to look into the issue of hunger and malnutrition across the states, and they recommended solutions to these problems, which were ridiculous. So in 1977, all the way to 2011, they've changed the dietary recommendations. So you have these terrible guidelines. They want you to get a lot more carbs, and they decrease the fat consumption. So the carbs 55 to 60%, the fat 40 to 30%. And so that was a very bad idea. And you'll see as we discuss this in detail. And many of the high fat foods are avocados, nuts, olive oil, avocado oil, lard, rendered lard that our grandparents used to make from pigs, or tallow from beef. And so all of these guidelines have been proven false in the last 10 years or so. And so now we have, just recently, 2005, they updated the pyramid to, it's called My Pyramid. And then in 2011, My Plate. So it really hasn't helped any, obviously, because the epidemic of obesity and type 2 diabetes it's going up constantly. So obviously, all these dietary guidelines are not working. They haven't worked. And so since they demonized these fats, now we've learned in the past 10 years that those are exactly the fats that we need to improve health. And so after all those changes that they've made, now we have, and then in 1980, there was over 108 million people worldwide suffering from type 2 diabetes. Okay, by 2014, that number swelled up to 422 million worldwide. And worst of all, it's not slowing down. So we basically have a 21st century plague on our hands. And so, another thing about type 2 diabetes, it has increased in both sexes, every age group, every ethnic group, and all education levels. And so now, and the saddest thing is that type 2 diabetes is now affecting young people. There were once upon a time pediatric clinics primarily treated type 1 diabetic children. And now there's so many adolescents with type 2 diabetes. There are even some babies born with pre-diabetic. And we'll get into that later. So it's really sad. Diabetes is just rising and rising. It's gone up in Japan and China and those places where diabetes wasn't that common. But again, they have increased their type 2 diabetic rates because of the westernized food that they've been eating. So now we have, for the first time in history, there are more people with type 2 diabetes than not. So over half the population has type 2 diabetes. And so that is very sad. And the saddest thing is it's not genetic. It's not part of the aging process. It's a lifestyle issue. And more specifically, it's a dietary disease. And we'll get into the detail on the next couple weeks. But most type 2 diabetics are overweight or obese and there's, as a result of this, suffer a lot of complications related to diabetes. Okay, so we have insulin and a bunch of other type 2 diabetic drugs that people are getting, and they're not helping. And so, and then as a result of that, there's people getting more heart attacks, strokes, Alzheimer's, blindness, kidney disease, and amputations. And there's a reason why. And, after 3,000 years of this discovery of type 2 diabetes, why is there no cure? You have to ask yourself, why is there no cure? Have you ever thought about that? And so, most of us know people that are, there's so many more people dying of cancer. I've witnessed in the last 15 years 2 children that have died of cancer. Very sad. And so the problem is that this type 2 diabetes disease has been misunderstood, gravely misunderstood. And so what do we have to do? We have to begin again. We have to undo a lot of myths and lies. And once we understand the cause of type 2 diabetes, we can begin. We can begin to heal ourselves. And like I said before and in every video, if you give your body what it needs, it will heal itself. Simple as that. It's a simple truth, but people really don't take the time to think about it. If you give the body what it needs, it will heal itself. And basically, you have to go back to the basics, and it's not easy. It is not easy. I'm the first one to agree with you that it's not easy. But before you leave, before we wrap this up, I want to tell you that there are a few things that you can do between now and next Saturday. I would love to tell you that between now and next Saturday, and this isn't going to hurt you, if you eliminate all processed foods, and I'm talking bread, tortillas, sodas, sweet teas, cakes, potatoes, cereal, oatmeal, donuts, whole milk, and I'll explain why eventually. But I promise you this, if you don't eat these foods between now and Saturday, you're not going to die. You really won't. In fact, you'll save money and you'll feel so good. Now, you may have some side effects, withdrawals, sugar withdrawals, and it's just your body so used to, it's like, like an alcoholic or a drug user. The first week or so is terrible because, you're having those withdrawals. And so if you can not, between now and Saturday, you're going to feel like a new person. I promise you that. And if you drink, of all the sodas out there that you think are the worst one is Sprite, 60% fructose. Mountain Dew, 59.48% fructose percentage, which is, not by much. Coca-Cola, 59.41. And Arizona iced tea. There's more, but those are the top 4 that are really, 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 really bad for your liver. Because unlike glucose, fructose goes directly to your liver. And that poor liver, I tell you, it works so hard. But if you can eliminate, if you drink those 4 sodas, those 3 sodas and that iced tea, you'll be doing your body a favor. No Sprite, Mountain Dew, Coca-Cola, Arizona iced tea. So if you can do that, your body will thank you for it. And of course, drink a lot of water. I drink about 2 liters a day. It's very good for you. Your body will get used to it. I do drink coffee too, keto coffee. I'm a keto gal. I love my keto coffee with Kerrygold butter and MCT oil. That's for another video. But in the meanwhile, if you enjoyed this video, and if you want to know more about type 2 diabetes, because I'm just getting started, I just wanted to give you a little review of that it is an epidemic, and that it's not genetic, not hereditary, and it's reversible. More importantly than anything, I want you to know that it's reversible and preventable, unless you're on dialysis. Yeah, that's kind of the, although there's still a couple of things you can do if you're on dialysis, but as long as you're on taking metformin and other type 2 diabetic drugs and some insulin, if you're taking up to even 100 units of insulin, you could still reverse it. And I'm going to show you and tell you how. I'm going to tell you how you can do that. So it's really, really to your advantage to tune in next weekend and the rest of the weekends, because I want to share what I know. I can't tell you everything because there's just not enough time. And, and I want you to understand each weekend the things about type 2 diabetes that will help you to live insulin-free lifestyle. And you don't have to end up on dialysis and amputations, because that's what eventually happens. Because basically with type 2 diabetes, it's a progressive chronic disease if you don't nip it in the bud. But basically your body is rotting from the inside. Yeah, everything is rotting. That's why people, type 2 diabetics, a lot of them, not all of them, a lot of them go blind. A lot of them get amputations. A lot of them have heart attacks, strokes. They get Alzheimer's sooner than later because they don't understand this disease. And they don't understand that their organs are rotting. And so I want to prevent that for you. I want these talks are for you. These videos are for you. And I want you to be well, and you will, because that's God's will, that's my will, and I know you want to be well. You don't have to live with type 2 diabetes. And if you just got diagnosed with it, if you're pre-diabetic, if you have a fatty liver disease, I promise you that type 2 diabetes diagnosis is right around the corner if you don't stop it now. But between now and Saturday, you can do your part and do what I tell you to do, what I just told you about what to eliminate. Now write that in the notes under the video there. But don't forget to subscribe if you enjoyed this channel. Click on subscribe, and then there's a little bell that you can click on as well that will notify you of the next when I've uploaded the next video. In the meanwhile, have a great evening, have a great week, and thank you. God bless you.